Uh, okay. Yeah.
Okay.
So I'm a psychiatrist and a psychologist and a family doctor, and uh, I've, I'm a descendant of Cherokee and Lakota people as well.
Hmm.
Um, and have have always been a little critical of our of the philosophy behind our mental health system. You know, the kind of positivism and reductionism and empiricism that we live and die by. I might say.
Hmm.
Um, and so it's really interesting to me when I can find people who are also somewhat critical and have other ideas about how we might look at people in the world. And so that was certainly
Hmm.
what I found interesting in what you're doing. Um, so, so that's a little bit about.
Sure.
I teach in a psychiatry residency program, um, and um, it's pretty conventional,
Hmm.
sadly. Um, but occasionally I can get a little bit in, and I just cut back. I'm just cutting back to 4 days a week so I can do a little wild and crazy stuff occasionally on the side. So I'm kind of excited about that. So that's a little bit about me.
Very good. Very good. How do you tend to do these interviews? What tends to work best from your point of view?
I think just talking about because it's it's really for our community and trainees and friends. And of course, we'll send you a copy of the recording to do whatever you wish with it. Um, but really, I think just the conversation is goes the best.
Good.
And particularly, I mean, I'd be really interested in like what you're passionate about today. Like, what are you writing about now that we can't read yet?
Hmm.
What's
Should we start at that end of things? Is that a good
Yeah, yeah.
place to get going? I mean, I think the last thing I actually published was about what gets called metanoia in some of the more romantic strains of psychiatry. So the idea of a certain, and it's a kind of originally a Christian concept, a Greek concept, to do with a certain experience of inner transformation. But it got picked up by both by Jung originally, actually, and then by Adi Lang. And the idea, I suppose, often in the more fringe psychiatry world, it gets used as a word for that. Yeah, the very romantic idea that well, maybe something like maybe psychotic experience and spiritual experience have got kind of quite a lot in common, or perhaps the idea that you could do a breakdown to break through, that kind of Stanislav Grof kind of idea, and so on, or yeah, the idea that maybe they're both kind of different ways of talking about the same thing, and I guess I find myself attracted to some of the romantic strains of existential psychiatry, but not totally convinced, and I was wondering if there's a different way of thinking about this concept of metanoia, something which brought together what I see as valuable in the Christian perspective and in the well, basically in a kind of a psychoanalytic perspective. So that was one thing that was the last thing I published, and then more recently I've been writing about soul and about what it is to pray, what prayer is. So kind of quite philosophy of religion themes. Um, and what I hope to when I finished those, I hope to get back to some major things about loneliness, shame, and psychotherapy as I suppose we could just summarize it as something like the idea that although in psychotherapy we tend to think that psychology is the main kind of discipline, as it were, which psychotherapy ought to look to understand itself in terms of. that virtue ethics, that ethics in some ways might be a more fruitful way of a set of concepts with which to understand what it is that's happening in psychotherapy. And there's a little, yeah, bundle of my headlines, as it were, of some of my recent
Yeah.
projects. I,
It's interesting because in the indigenous world of North America, there's um, there's a general belief that all experiences are real, that they all have ontological validity, so that um, psychotic experiences and spiritual experiences are equally real. But um, the the elders that I've known would say that they may take place in different locations. That
uh-huh.
um, sort of the non-ordinary world has many regions that you can visit, some of which are pleasant and some of which are not. And
Do you
uh,
think this is an idea that's easy to make sense of? I mean, for example, if we took it very literally, if someone said that to me, I think that all experiences are real. I mean, I wouldn't know what they meant first off, I suppose, but I might think, well, you presumably that these people someone who thinks that also has an idea of misperceiving something, mistaking a cow for a goat or something, or I just use a stupid example, but also perhaps they have an understanding of what it might be to hallucinate something whole cloth, to not only kind of misperceive something, but also or to have an illusion, sort of, to hallucinate. And so I'm wondering, is it that they just don't? And then if let's say they said, well, I don't know if I do think there's such a thing as hallucination. I'd wonder why not. Like, well, what would be getting in the way of someone being able to avail themselves of that concept?
I think they would say that the people are walking in two worlds and that they're um, behaving and perceiving in one world and speaking it into another world, and therefore it looks really crazy. Um, I don't know if you know this fellow in Australia. His name is Matt Ball, and he has this theory called dissociacosis. And he talks about how when your ordinary life is too awful, that you dissociate into these other realms. I don't know how much ontological validity he gives these other realms, but but um, you enter into these other realms, and um, they're better in some way, more predictable, even if frightening, um, maybe more comforting.
Hmm.
And he talks about this notion of going into that realm with them in order to walk back with them into the ordinary world. And I thought, that's, I mean, that's a lot like what Lang and Joseph Burke, I think, were trying to do in the sort of early days of their houses, was to enter into the experience with people and and to kind of walk back to some semblance of ordinary reality.
I think even if one maintained a fairly, I don't know, a kind of fairly pedestrian ontology or something, right? So, and one thought, well, yes, this talk of other worlds or other realms is somewhat metaphorical or something. You could still go a long way with that kind of idea, right? So that somebody has a delusional experience. Maybe it's what would traditionally be classified as such anyway, and we say even in a lay way, we say, well, they've gone into a world of their own. And whether we think that's a genuine world or it's an ersatz world or whatever might not matter so much as clinically that is, in term rather than understanding why they need to be there, what the function of the delusions or hallucinations is in the sense of, although it might be horrendous for me to live in a world populated by persecuting agents that could come up at any time and, and kind of kill me, that might be more stabilizing than my whole self and the fabric of my worldhood falling apart. So in order to bind the terror, if you like, you need a pretty terrifying delusion to bind the more inchoate terror of it, which comes along with ego dissolution, you might say, right? So, and I've certainly made a mistake, with a patient who is very, very. We had various, I won't go into the details, but he had various delusions of either being able to be merged with everybody or be completely by himself in outer space kind of thing. And I remember I stupidly kind of interpreted the delusion. So I said it seems to me that you're struggling with ordinary distance kind of thing, and he suddenly came out of that sort of state he was in, call it his own world if you like, and became absolutely kind of terrified and said, well, that's of course that's why I need to be. That's why I need to believe this, and then went back. And I realized what a terrible mistake I'd made. I should have found a way to walk with him and understand more about what it is and not just kind of clash the worlds against each other, if you like.
Yeah, yeah. And when it works, it's incredible. And when it doesn't, it's not so great. I mean, um, I had um, I had a client who believed that her former downstairs neighbor had this amazing electronic equipment and was broadcasting thoughts and reading her thoughts. Um, and that was causing her great distress. And for some time, we were, my colleague and I, whom I was working with, um, we were able to do ceremony with her and indigenous ceremony around a fire and keep the broadcasting at bay. And actually for about a year, but something shifted, and I suspect um, it had to do with substance use, and
Mhm.
it no longer became effective,
Mhm.
and and uh, things went you know terribly downhill for her. She
Yeah.
lost her housing and whatnot, and
So from a traditional psychiatric perspective, one might say something like one can do some good work by kind of consolidating a delusional system or something like that for a while. And one might also say that one can, even if one doesn't think that's a great idea, one could do some good work to not by simply challenging it, but by building up the capacities which have been lost, the loss of which, or the relationships which have been lost, the loss of which has necessitated, again from a traditional psychodynamic perspective, necessitated a flight into a alternative reality. Um, and so that one could then understand it symbolically and then build up, reality testing. One thing I think people don't understand, and again, it's like a traditional thought before we perhaps get back to the intelligibility of the idea of genuine, as it were, alternate worlds, and to use your language, like ontologically real in some sense, like the alternate realities is that simply you sometimes hear psychiatrists saying something like, well, it can't be motivated. The formation of these, what they would call delusions, can't be motivated by psychological needs because the person ends up in a worse state for believing in them than they were, they would be otherwise. And I think this is like really misunderstands so much of human psychology that, in a very ordinary way, like whether it's the things we do if we get depressed, we might kind of just stay inside and not really, go out because we don't feel like it. In some ways, in the short term, that makes us feel better, right? But ultimately, it kind of gets us into a bogged down kind of state of being. But similarly, I think all sorts of kind of psychological problems can arise from the pursuit of what in the short term are very relieving kind of strategies, but then build up greater problems. And I don't see why the same shouldn't be true, but of in terms of the psychodynamics of psychotic experience too.
I think humans want explanations, and a demon is as good an explanation as any, or a persecuting voice is a reasonable explanation for why you feel miserable. And it might be easier to fathom than the complexities of a miserable childhood and a messed up um, family life, not to mention the difficulties of living in a capitalist society with any level of suffering. So
I guess- that's interesting because I I think I agree, but I think I want to distinguish two different kinds of explanation here. And one of them, and what I notice is psychologists often, it seems to me, appeal to the wrong sort. So one kind of explanation would be something like, I'm hearing, like a voice in my head. I wonder what causes it. Oh, I look around for an explanation of this. I think, oh, it's a demon. So, in other words, all delusions are kind of secondary in a way. They're attempts to make like a reflective sense of a under, an experience which is there anyway. And but there's another kind of sense making, we might call it, which is more immediate and more actually part of the experience itself, whereby if one has an inchoate and diffuse and difficult experience, it's not the reflective activity takes, it's not that you like a little scientist and form a hypothesis. I know hypothesis, let's scratch the hypothesis. I might be losing my mind because that would be the obvious one because we all know about that, but we forget that for no good reason. And we're just going to go for the demon, right? Because I've heard about demons down my spiritualist church. It's like, no, it's much more that the demon hypothesis comes along with the very experience itself, but it provides us it, in experience itself, sense is made of the world. I mean, let's put it like that, rather than that one's busy making reflective sense of an experience. And I think it really matters that because if you're a psychologist and you think, well, I wonder if we can make some other kind of, if you imagine that the patient has just got the wrong, got a hypothesis that's either wrong or not fruitful, or however, you like to think of it, and then you start trying to kind of challenge, you might be totally missing the way in which, when using Karl Jasper's notion of primary delusion, the delusional explanation is totally intrinsic to the very experience itself. And it gives it body and shape, and the sense of stability of self, the relief it brings, isn't the relief of thinking, oh, now I've got a good explanation. It's the relief of like life in a sense making sense again. Now, because I think I'm probably more skeptical about some of the ontological reality of some of these things than yourself, and I think I would question whether or not delusion, for example, or what I would happily call delusion, really does make kind of bona fide sense, or provides instead like an ersatz, like a semblance of sense, which is relieving and comforting. But in some sense, at least, it makes sense of the experience, I would say.
Yeah, I think I'm drawn to the sort of magical realism of indigenous thought.
Hmm.
Like,
Yeah.
there's something quite appealing about it.
Hmm.
And in um, in in watching these traditional healers work with people who are psychotic, um, there's something very compassionate about their use of that approach, that they um, can approach the person with a, oh, you've you've managed to fall in with a bad crowd, in a bad dimension, or in a bad part of the um, spirit world, and we're here to help you out. We're here to help you get out of that place and come to a better place um, that we know.
Hmm.
And if you're if you've grown up in that mindset, I think it works. I mean, I've
Hmm.
seen it work, and I've seen it not work for people. Like, say, urban Indians who haven't grown up in that way of thinking about the world
Yes.
don't necessarily take to that approach.
Yeah. Yeah, that's very interesting. Yes.
Yeah.
Might not be something that could simply be exported everywhere. And yeah, it might have to think. Well, yeah, sure.
But it made me think of Waters' book, Crazy Like Us. You probably
I've not
know.
read it actually. No, no.
Oh yeah, it's a very good book. And one of the chapters is schizophrenia comes to Zimbabwe.
Hmm.
And he writes about the export of the concept of schizophrenia into that country, especially the rural populations. And,
Hmm.
and it's sort of absolute um, friction with their concepts, which were working before the Eurocentric concepts got dropped onto them. The
Uh-huh.
notion of evil spirits and um, bad entities and um, but it was that same sort of thing where they'd all grown up together in the same culture, in the same way
Yeah,
of thinking about these things. And
sure.
so I think it was um, Shorter that talked about the the times when people have inarticulatable suffering that has to congeal into something, however
Yes.
strange that it may be. And
And maybe it doesn't matter too much in a way, as long as it's kind of, I'm not saying believable might not be the right word, but imaginatively accessible, and the symbolism can do its causal work for you, as long as you're kind of you're culturally run through enough with those kind of modes of experiencing body, self, time, and so on, right? So that can be more. Speaking of like spirits and so on, I was thinking, I recently went on a 3 day online training with Alan Abbas, who's in the ISTDP, Intensive Short-Term Dynamic Psychotherapy kind of world, kind of form of psychotherapy invented by Habib Davanloo. And it's a very kind of punchy kind of psychotherapy. And it was explicitly for FN, functional neurological disturbance, so conversion, hysteria, whatever certain type of psychosomatic kind of concerns, and so um, so what he does, so he uses a lot of video in his work, so you see the kind of patient's progress in the trainings, and you saw people kind of really coming back to life from kind of states of paralysis or pseudoepileptic seizures, um, or well, all kind of all sorts of kind of conversion type kind of problems. And what he found helpful was you'd encourage the people to, especially get into touch with and uncover and increase their tolerance for powerful feelings of like murderous rage, and also the guilt at their anger towards loved ones. So rage towards loved ones and guilt towards that, and also the love that they once felt at least. And as you saw people build their ego capacity, their capacity to tolerate these kind of feelings again, you could see that the symptoms begin to drop away, and it was it's very striking work. And I was thinking about, because I thought, well, this looked kind of biblical. There's something about these people kind of getting up. It's very secular, psychology he's working within, but it was um, it struck me as having this kind of New Testament kind of quality to it, that just, and what I was thinking was that in the New Testament, Jesus cures various people. There's a book called Jesus the Village Psychiatrist. I forget the name of the author now. Um, and in the book, he makes the suggestion that various of the problems that people were being cured of. There's one called like leprosy, which I think is more like just skin problems, which are themselves, not what we call leprosy today. But also paralyses, blindness, which can be hysterical, and these kind of possession states, which often involve kind of pseudo-epileptic type kind of presentations of convulsions and so on. Um, the kind of things of which some of the people he was curing anyway had this kind of FND type presentation. And I was thinking, this is interesting because the chap who wrote the book, Jesus the Village Psychiatrist, didn't comment on this, but um, what was in common between what Jesus was saying, which was, your sins are forgiven, take up your bed and walk. That it was the focus on guilt which was powerful there, and which enabled them to be released from the demonic possession, or what at least they called the demonic possession. That made sense to them. And similarly in the Abbas, it was this focus on guilt, the capacity to tolerate the guilt, and that was relieving of the person from their FND. And I thought, I wonder if, so we kind of missed a bit of a trick there, or at least, the idea that pathogenic guilt, or guilt that can't be tolerated, it might be realistic guilt for all that matter, but if it can't be tolerated and brought in sympathetically into line with other feelings, will come out in these ways. I remember reading a case by, what was he called? That's French psychologist, Janet, the late 19th century French psychologist, and of this chap called Achille. And Akil was this man, maybe he's about in the young 30s or so, and he went off on a business trip one day, came back, and he was kind of mute and troubled, and started kind of running out into the woods at night naked, and then he tried to kill himself, and then he started speaking in this kind of devil voice, and kind of presented as possessed. And Janet wasn't the only, this is so it's like early Freud, pre-Freud kind of time. And Janet had very hypnosis was the only kind of, clinical kind of technique, if you like. So it tried to hypnotize, didn't really work. Eventually, though, managed to communicate with the possessing demon through automatic writing using his non-dominant hand, the patient's non-dominant hand, and got from this demon that the patient Akil had actually, when he'd been off on his business trip, he'd have an affair, so he cheated on his wife, and this the guilt at this was the thing he couldn't actually tolerate or find any way to manage in any way. And Eugene also did the kind of some of the tests that the medieval exorcists used, like pricking the skin to see if he was insensate or not. Was one of their tests for genuine possession. He passed all the tests, as that he could muster. But the slightly kind of, I don't know, it's slightly disturbing in a way, kind of where he got to with this was he got the chap to effectively have a dream or have a hallucination or just to vividly imagine perhaps his own telling his wife about the affair, and then to imagine his wife forgiving him. And as he did that, then the possession state passed. So he was something about the guilt could be owned, mentalized, to use that modern language. He could actually give it. Psychoanalysts talk about symbolize the guilt, give it some shape, make it thinkable, make it bearable, tolerable, sufferable, and then be able to actually, I think if you try, it's the kind of Christian one too, is like on the one hand, yeah, you're a terrible wretch. On the other hand, it's okay because you're lovable, you're a lovable wretch, and that makes it possible for you to own your bad, like own the guilt, and that seems something like that seemed to happen there too, and I found that very interesting, that moral focus, if you like.
Yeah, that is really interesting. We're not too far from Abbas because he's in Halifax, I think, Nova
Yeah.
Scotia.
Uh-huh.
And I've read so many of his papers, and it seems fascinating, and yet, we can't really do what he does because it's a totally different economic system
Hmm.
where we're paid, by the visit, and he's paid if he prevents visits.
Yeah.
So,
Well, a lot of his work is papers are on the kind of the economic savings of that's the way he worked out, I guess, the way to sell it, to try to sell it anyway to the, you know, um,
right,
health providers, is that this
right.
makes massive sense economically if you can, get people up and running again, if you like.
Yeah, yeah.
Yeah.
Yeah, and I think the Canadian system, it's so much easier to do that kind of work because in the American system, insurance is not really fond of it. It's not really fond of psychotherapy at all anyway, but
Mm-hmm.
and so um it doesn't have the support. And what I thought was interesting is that it seemed like or at least in one of his papers, it's about half of the people will agree to do the therapy in the
Hmm.
in the emergency room setting, and the other half just want their diagnosis. They want to
Yes.
stick it out to the bitter end
Yeah.
of testing ad nauseum.
Yeah.
Yeah.
Can we come back to the idea of what well, I'm thinking about this ontological question you mentioned earlier, and what do we make of what do we make of, or what do I make of things like, say, certain more kind of shamanic approaches to healing, for example? What's coming to my mind is a paper by, I think it was Levi Strauss. I read a woman who was stuck in childbirth, couldn't, give birth. It's kind of some kind of constricted parturition thing, and so the practice there was, along with the midwife, that the shaman would come along and have it. There was a big kind of story that, do you know this? I mean, maybe I think it's quite a well-known, it's kind of piece of,
No, no, I don't know this story.
and that, so he takes the woman on this big journey, lots of drumming going on. I don't know what else was going on, but and takes on this journey, and they go into the abode of Mu, and Mu is some kind of goddess of some sort, and they have to go through this kind of narrow kind of tunnel, and then it goes into this kind of chamber. I guess it symbolically maps onto her womb, and so on, and cervix and things, and but that's not ever mentioned, and in this, and then they make some, I think they entreat the goddess in a certain way, and they do some deal, or some sacrifice is made, or something has happened which allows the woman to then give birth. And what struck me about it, and it seemed to me that you get this kind of thing in play therapy too, with children, and in certain dream functions, and so on, is that, rather than us thinking, oh well, I mean, what seemed to matter is that they weren't sitting there and having some straightforward chat about, well, giving birth or something like this. That what was necessary for her to begin to form the kind of feelings of, begin to mentalize fear, and to begin to get the idea of a kind of surviving something, or she needed to give imaginative shape to the experience, and it might have been better off being in some symbolic transformation, in a different mode, like, the child in play therapy. They don't just say, oh yeah, this is my daddy beating my mummy. This is like the nasty alien man, and now he's fighting this alien woman, or whatever, doll, and that the fact you're not just staring it in the face with the cold light of reality, but instead you've got this imaginative transformation, unlocks the symbolism, unlocks the emotional dynamics, if you like.
Yeah, I think it speaks to change is easier in non-ordinary reality than it is in ordinary reality, which is that sort of theta rhythm brain state where amazing things can shift. That, and I think that's the whole, and maybe a big part of psilocybin assisted psychotherapy is that it just gets people into this other brain state in which change is more imaginable. Things are not
Mm,
as fixed. Um, I read something about how in these sorts of liminal states that the connectivity among the various parts of story brain are relaxed.
hmm
You can you can more readily imagine different stories than the one you habitually tell yourself about the world and who you are and how things are supposed to work.
hmm Yeah.
Um, and it makes sense. There was a time when I and some colleagues were really interested in sort of the psychodynamics of childbirth. And we worked with some midwives, and we had some amazing results in using these sort of techniques, sort of neo-shamanic techniques, in advance to prepare women for labor. And
Mm,
I think we helped them get down to something like a 2% cesarean rate, which
hmm
is remarkable in our times.
mm.
In the hospital where I work, it's 50.
What's the normal rate? Sorry.
Well, it's 50% in the hospital where I work
Oh
now.
goodness. Okay.
Yeah.
Hmm.
I mean,
Very
used
interesting.
to, it was considered terrible. I mean, 50 years ago, it was terrible if you had a 10% rate, but times they are changing.
Yeah.
But yeah,
Yeah.
the it was really quite remarkable, um, sort of doing that kind of work. We did it preparatory because we didn't want to get up in the middle of the night, and go with the midwife
Hmm.
because we're lazy
Hmm.
psychologists.
Well, I mean, fair enough. Fair enough. It worked, right?
Right.
What I'm wondering though is, so you and I have got different, I don't know if it's different linguistic habit or a different kind of set of fundamental beliefs around this, this idea of reality. Because for you, it comes naturally to say, go into a different reality. And it doesn't come naturally to me to say that. I think I'd want to say it's important we don't get too focused on, I don't know, accuracy of representation over like symbolic function or something like that, or accuracy of representation, or over imaginative participation, or discursive thought over I don't know, something more embodied or something. I can imagine saying those things, but it wouldn't come naturally to me and I don't want to just assume that words like ontological validity or have much sense outside of a very particular kind of philosophical conversation. But I think, yeah, it might be that I'd be less likely to kind of think. In a way, I want to just not worry about the reality question, really. I suppose about that, and just put it to the side. But I think it sounds like it's more important to you to be able to want to say no. They're genuinely, or there was when you started by saying that, and for them all experiences are in some sense real, and
Yeah,
but
that they
it does.
happen
Mm,
somewhere would be the perspective of the elders, and I I I suppose I grew up in that way of thinking, and so it's easy for me to think that way because it was the culture that I knew or know and still participate in the traditional indigenous cultural practices and ceremonies and whatnot.
well,
Uh,
but Lewis, if you had a dream tonight, and in the dream you were, I don't know, like you dreamt that you were fighting a certain monster, or so, I don't know, like running through a apocalyptic town, or whatever, right? And then what kind of turns on, and then you woke and you say, well, that it wasn't. Someone might say, oh, it was just a dream, and they say, did it really happen? No. What it means, and what that means is it was a dream, right? It didn't kind of really happen, those things. And then someone else comes along and says, well, no, it did happen. It's just it happened in a different place, or in a different world, or a different reality. Um, wh- what's the real difference between these two people, I suppose, is one thing, like one who, are they just speaking differently? Does one of them just like the word real, or something like that? Or is there something, does something hang on this different way of, these different things that people want to say?
I think it may lead you to different questions, but the answers may ultimately be the same. And so here's an example from a dream I did have a couple nights ago. Um, I was I was flying my wife and I to dinner in a helicopter, and in the middle of the dream, I said, "But I don't know how to fly a helicopter."
Hmm.
Yet I was flying the helicopter,
Hmm.
and it came time to land it on top of a building in a big city. And I'm like, "Holy shit! I don't know how to land a helicopter," but I landed the helicopter, and and we got out of the helicopter and went down to street level. And I was busily trying to figure out if I had a license to fly a helicopter.
Hmm.
So the magical realism interpretation or the shamanic interpretation would be that I dropped in to someone's body. Briefly, I shared someone's body who knows how to fly helicopters. And then the question will become, well, so why was I attracted to that guy? Like, what is it that made me drawn to be a part of his world ever so briefly? You know, um, do do I want to, you know, feel like Elon Musk and have the money to fly helicopters to
Hmm.
the top of buildings? I mean, I don't, I actually am still trying to figure out what that's about. But it brings to mind um, Penrose and Hammeroff. I don't know if have you read those guys? They're an
No.
interesting couple of guys. Penrose is at University College London, and Hammeroff is at the Center for Consciousness Studies at the University of Arizona.
Hmm.
And they've figured out that um, we flicker into this reality 60 times a second based on
Which reality? Sorry.
that we're present in this world of ordinary consciousness,
The ordinary world. Okay. Hmm.
ordinary world 60 times a second based on the rhythm of the dendritic gap junction. And and so they pose the interesting question, so where are we when we're not here? And and what's fascinating is more than 2,000 years ago, the Buddhists came up with the same conclusion. The Buddhists said that we occupy, our consciousness is present 40 to 60 times per second here. And where are we when we're not here? So that's sort of my um, science behind magical realism potential
Uh-huh. Uh-huh.
is that maybe we are somewhere else when we're not here.
Well, I mean, to me, it's mystifying. It adds more mystific. It's more mystifying than elucidatory. I mean, for example, I don't really care what goes on in my dendritic gaps, or whatever it is, but like, as for no, I'm in my front room, right? In the ordinary language sense of where am I right now? I'm in my front room, and I'm here until I leave the front room, by the door over there and so on. I'm baffled by the idea that I'm as it were, accessing the room 60 times, or that there's a useful sense of the word here, which could be used to mean that I was coming and going, even though I was sitting at my desk all during this conversation. Yeah, but I think I don't have a very metaphysical. I mean, I don't have a metaphysical temperament, but I'm also very influenced by philosophers like the Ordinary Language Philosophy School in England, the Ludwig Wittgenstein and Gilbert Ryle and so on. And they don't, their temperament is not very suited to metaphysical kind of type of explanation. Or I'd be like thinking, well, Lewis, what do you really mean? You're not here 60 times over. So you must go somewhere else. Like, well. Even if you were zoning out at 60 times a second, it wouldn't mean you were going anywhere else, right? It could just be you were just not conscious 60 times a second. But actually, of course, you are we don't measure conscious presence in terms of microseconds. If you're doing a coma scale, if you're doing a seeing where I was on the Glasgow coma scale or something, you wouldn't say, "Oh, look, he was not there for a 60th of a second. He's obviously losing consciousness for it." So no, like he's responsive. Look, yeah. So
Yeah, yeah.
yeah. Mm.
I suppose one side effect of this whole magical realism shamanic way of thinking is that it gives one permission perhaps to be a little more playful in the therapeutic work
Uh-huh.
and a little more adventurous.
Hmm.
At least I feel that when I compare, you know, work that I've done to some colleagues who are a little more rationalistic,
Hmm.
that I perhaps feel more able to venture into these worlds of the clients and it reminds me of we worked with a young man who thought he was the reincarnation of Adolf Hitler and that he should kill his parents so he could be properly punished. And and so it was a very strong fixed delusion. But but what shifted it was we got him into writing a science fantasy story about alien invasion and and how only the dogs could fight back against the aliens because
Mm,
they lacked a prefrontal cortex. And so the aliens couldn't control them. And so whenever you're overwhelmed, then you need to call on your dog. And he had a dog, and he called on the dog, and he would go walking long distances with the dog when he was feeling, overwhelmed. And I remember one particular memorable evening when he called us and he said, "Oh, I was just calling you. I'm going to kill myself tonight." And we said, "Well, you better have some chili first because,
mhm,
one doesn't want to engage in such activities on an empty stomach." And he said, "Oh, that's a marvelous idea. I should make myself some chili."
mm, mm.
I said, "Well,
Yeah.
why don't you do that and then call us back and tell us how it was?" And he did, and he called back and he said, "Oh, it was marvelous chili," he said, "and I shared it with my dog, and the dog loved it too, um and I feel a lot better. I think I'll just go to bed."
Oh, yeah, nice. Yeah. This kind of playful, it reminds me a bit of some of I used to, decades ago now, be very interested in the teaching tales of Milton Erickson, the
Oh,
American
yes, yes.
hypnotherapist. And he was full of this kind of playful, mischievous kind of thing. But in a way, like, it's sad that one would have to give oneself permission to adopt a more imaginative and playful, mode. And it makes me think, what you're telling me is that it kind of works, or at least sometimes, engaging in a very different kind of, non-rationality first kind of way of engaging in therapeutic interaction, or what you want to call it, that can be very effective. But of course could be itself, one could very rationally show that it's irrational to be rational, right? I mean, right, one can rationally show that one perhaps does better even with many people in many situations by pursuing a mode of engagement, reawakening certain capacities for pleasure or play or symbolization and so on. And I think that the one of the kind of in fact, Jonathan Shedler, the American psychotherapist, has been very good on this. That um, the idea of evidence-based psychotherapy can be a bit of a sham, in the sense that just because somebody does bother collecting some evidence for a particular kind of therapy doesn't mean you've got evidence that it works better than some other kind of therapy. I mean, that'd be one clear thing. But also that, I mean, this is not his point now, but and then he does kind of provide some evidence that actually, for example, psychoanalytic psychotherapy does as well in all sorts of ways as therapies which have, been more concerned to find evidence for themselves. Um uh, but also that the kind of mode of cognition one gets into when one's doing things like testing therapies might be completely the wrong kind of thing to be in when one's actually trying to do therapy. And it reminds me a bit of, when someone like Descartes sits there and, in his study, kind of sucking the end of his pencil, trying to think about, how you make contact with reality. And he's completely just static in a chair, right? And he's just kind of thinking, and it's almost like he loses a sense of himself as an embodied being going about the world amongst his friends and things. And you start to be able to think things like, oh, maybe that person outside the window is actually on an automaton or something, because you've got disengaged, and you start trying to rationally reconstruct how you can make contact with reality, forgetting that normally we're not in the business of having to make contact with reality. We're living part of it, and so. And it reminds me of that. One gets into the wrong mode. You read developmental psychologists sometimes say things like, "Well, children are like little scientists," and well, they're not, are they? They're not like little scientists at all. I mean, it's just obvious. Like a child, whole mode of cognition is different, even if sometimes they are making little, like testing things out or whatever. Mm.
Yeah, yeah, no, that makes sense. That that what we do as therapists is not necessarily related to how we think about what we do as therapists.
Yeah.
And and it um it reminds me of a famous saying of Yogi Berra, the baseball player. Um,
Hmm.
and he said, in theory, theory and practice are the same, but in practice, they're often different.
Hmm. Hmm. Yeah.
Yeah.
I think one kind of, I mean, I'd say that I myself am part of my identity, part of the way myself is structured is quite, I'm quite a rational being, and I'm happy, I'm happy with that. And it's important to me, and for quite a few of my patients too, so it wouldn't necessarily be very befitting, or it wouldn't be very dignified in certain moments if one were just to kick over the rational project of trying to make a certain kind of more reasoned sense of certain things. Um, but even there, right, it'd be a tragedy. I mean, it simply isn't the case that one best accesses one's emotions, for example, if one is estranged from them, through a kind of reflecting on the truth of whether or not one has it and looking for the evidence and listening to other. No, it's again, it's like you go and watch the movie, and then through some imaginative participation in it, suddenly you find yourself in floods of tears when you're in a parallel situation to the person in the like movie, but you can't just do it by reasoned reflection. So, but no, I mean, that's just to set by way of coming back to your point earlier that for some people who've raised in a certain kind of culture, it may be that a certain kind of symbolic way of making sense of things makes absolute sense. But if like you said, if the Indians move to the city, then they might lose that access. But there might be something else that structures their selfhood, which is important to. And for myself, I think I'm kind of quite fond of reason, so that's my.
Well, I mean, there's certainly reason has its place. Definitely. Yeah.
So,
Well, I think we're probably getting to the end of the
good,
time that was allotted, and it's been a fun conversation.
good to talk to you.
Yeah, I'm looking forward to reading more of your writings and
Good. And I hope to write something on, like I said, on loneliness soon. I'd like to write something for the general. I wrote this thing on madness, which happens to be convenient on my book. It was a very philosophical, very academic philosophical book, and hardly anybody should read it, right? Because it's very niche. But I would like at one point. I think I've got some things to say about loneliness that aren't just standard issue things about finding friends or something. So hopefully one day I will also find and put that out there as a partly as a way to make myself hold myself to some commitment to actually do the thing.
yeah, that'll be great. I'll watch for loneliness to appear. But I wouldn't diminish the possibility that people who are watching would want to read your book on psychosis because we all may live in the same niche.
Sure, yeah, that's a good point. Yeah, I mean, yeah,
We're all
yeah.
little crabs clinging to the side of the shore, in the same cave. So
Speaking of crab, just a final thing on crabs. I went to a conference. It was actually an anthropology of psychiatry conference a while ago, and there was a chap in Oxford, and we went to the pub afterwards. And I said, "What do you do?" And he said, "Well, I'm an anthropologist, and I spend a couple of months each year in a couple of villages in I forget where, somewhere in Africa." And what they do there is that they want to make a decision about something. They dig a hole in the ground, and into the hole they either put a crab or a tarantula, depending if they're near the shore or in. And then they put these sticks on top, and then on top of that they put these playing cards or cards with a kind of and then they put a question to the crab or the tarantula, and then it moves, and then the card falls a certain way, and then that's how they answer the question. And I said to him, is this a good way of making decisions? He said, yeah, it seems to work pretty well for them. So it's another nice example of how actually, yeah, in the in face of the daunting anxieties of life and all the predicaments we find ourselves in, just being able to outsource your decision making is probably the most important bit of it. And then just doing something rather than nothing is probably the second most important thing, rather than thinking, oh, what's the best thing to do? Otherwise, one can just, I don't know, freeze on the spot like Burradon's ass, thinking which of these two equally tasty portions of carrots should I go and eat? And and it's because it's a rationalist, it can't make a choice between them, so it just starves to death. And yeah, so that again, as perhaps another point in favor of crabs, in favor of a bit of a plea for a measure of irrationality or non-rationality, irrationality, let's say.
right, right. That's a great example. Yeah.
Yeah.
All right.
Good.
Well,
Okay, cheers, Lewis. Yeah,
yeah,
thanks
thank
for
you
coming
so
on
much. And
in
I
future.
will, here, let me stop the recording.